talk a little bit about cubital tunnel syndrome because it's a very often missed peripheral nerve entrapment of the upper extremity. So we're talking about the ulnar nerve. Okay, so that runs down the mid part of the arm here. As we all know the funny bone. That's obviously where the ulnar nerve is at its most superficial, so really easy to knock, shooting pain down the arm. Obviously it's not that funny, but it is for other people. So it comes down through here. The two entrapment sites, medial head of the triceps, which is, as far as I'm concerned, missed a lot of the time. Secondary entrapment will be the flexor carpi ulnaris muscle. So in terms of release work, I think it's always important that we address any of the upper entrapment sides. So quite easy to find that medial portion of our tricep muscle coming through here. Keep in mind, if we wrap round, bring it back up against the humerus itself, and then we can glide through the medial head. We can pick up any of those restrictive trigger points in that medial head of the triceps, which will predispose to that cubital tunnel syndrome. So as I come down lower, there's a nice little trigger point in the lower half of that, which is about there, isn't it, Cal? So we get to do a little bit of extension of the wrist as well, just to open up that whole fascial line through there. Okay. And then we can come down past the elbow and then pick up our flexor carpi ulnaris. And you ask, how do we find that? It's a good question. So first thing we do, get our clients to make a fist, okay, like that, and we're going to get them to move into ulnar deviation. So if you keep doing that for me, so then I can come around here and just palpate, and you should feel it pop up underneath your fingertips. You'll know that you are on flexi carpi ulnaris, all right, you can relax. So that nerve dives down through there. So if we're getting some hypertonicity through there, or that tricep, obviously it reduces the space or the tunnel that it needs to work in. So that's obviously when we're going to start to get some issues with that cubital tunnel and that ulnar nerve. And what are the symptoms of? Obviously you're going to have classic pain into those two fingers. Obviously any sort of elbow flexion with the wrist out like this, if you're leaning on, then obviously you're going to start to get some paresthesia running down those sides of the hands. Not unlike some people who work at their desk for long periods of time, or once again, our throwing athletes. So once again, closed fist, ulnar deviation, pick up the muscle. The trigger point is in the upper half, obviously, but it's not just the trigger point we're after. We want to work the length of the muscle. And as we go through, just in a static position first, and then let's get Cal to go into what we call radial deviation, so it's away. Okay, so he's going to move up towards me, that's it, back down again, and then up again as well. Good stuff, Cal. Good. All right, and obviously we can take the forearm flexors there to help that cubital tunnel offload that area as well. Keep in mind, medial head to triceps, flexor carpi ulnaris, and remember at the same time as well that how to palpate. Obviously it's easy. Closed fist, ulnar deviate, it should pop up underneath your hands.